Hello and welcome. Let's talk about hormonal contraceptives. So, now classification of hormonal contraceptives. It may be oral contraceptives or parenteral or injectable or implanted contraceptives. The parenteral or injectable contraceptive includes medroxyprogesterone acetate, which are the intramuscular injection at 3 months interval, or implanted contraceptives includes levonorgestrel known as Norplant, which are contraception up to 5 years. Now, oral contraceptives. It may be combined pill with both estrogen and progesterone. According to combination, it may be monophagic, biphagic, and triphasic. According to dose, it may be low dose pill or standard pill or high dose pill. Or there may be mini pill, which is progesterone only pill. Now, estrogen preparation used includes ethinyl estradiol, which is most widely used, mistranol, conjugated estrogen, and stilbestrol. The progesterone preparations used includes levonorgestrel, norethindrone, ethinodiol, and norgestimate. Now, mechanism of action of oral combined pill. Now, prevention of ovulation, which is a primary mechanism of combined pill. It inhibits mid-cycle surge of follicular stimulating hormone and luteinizing hormone. Estrogen inhibits secretion of FSH, so no follicular growth. Progesterone inhibits secretion of LH, no LH surge, so there will be no ovulation. Prevention of fertilization, the change in the cervical secretion and changes in the motility of uterine tube. Prevention of the implantation includes that the implantation does not occur unless the endometrium is in the right stage, and this depends upon the balance between estrogen and progesterone. This balance is disturbed by the combined pill and prevents implantation. Now, pharmacological effects. On ovary, there is depression of the ovarian function. Smaller ovary, follicular development is minimum, and corpus luteum and stromal edema are absent. Effects on the uterus and cervix. Cervical hypertrophy and polyformation. Cervical mucosa appears thick and less copious. And on breast, there is enlargement and there is suppression of the lactation. On CNS, there is a mild change in the mood and behavior. Estrogen increases the excitability of brain. Progesterone decreases the excitability and thermogenic action. Effect on the uterine function includes inhibition of the pituitary gonadotropin, adrenal structure and the function alteration, increase in the CBG, TBG and T4, increased renin-angiotensin activity and aldosterone secretion, leading to increased weight due to salt and water retention. Effect on blood includes thromboembolic phenomenon, increase in the factor 7, 8, 9 and 10, decrease antithrombin 3, increase serum iron and total iron binding capacity. On liver, there is increased synthesis of the gamma globulin and fibrinogen, decreased flow of the bile, increased cholic acid proportion in bile, decreased chenodeoxycholic acid, and make increased incidence of the gallbladder stone. On lipid metabolism, there is increased serum triglyceride, decreased free and esterified cholesterol, increased HDL and LDL, and these are due to estrogen. On carbohydrate metabolism, there is increased rate of the carbohydrate absorption from the GIT and increased basal insulin and increased insulin induced by the carbohydrate ingestion. On CBS, there is slight increase in the cardiac output, increased systolic and diastolic pressure, and increase in the heart rate. On skin, there is increased pigmentation known as chloasma, and the acne may be seen. Clinical uses includes oral contraception, postmenopausal syndrome, severe dysmenorrhea, endometriosis, failure of ovarian development, postmenopausal osteoporosis, dysfunctional uterine bleeding, premenstrual symptoms. Adverse effects mild includes nausea, mastalgia, edema, headache, migraine, changes in the serum protein, and increase in the ESI due to increase in the fibrinogen. Moderate includes breakthrough bleeding, weight gain and hypertension, increased skin pigmentation, acne, hirsutism, uterine dilatation, vaginal infection, and amenorrhea. Severe includes vascular disorder like thromboembolism, decrease in the venous flow, endothelial proliferation, increased coagulability. Myocardial infection may be seen. Moderate to severe hypertension, severe vascular disease, cholestatic jaundice, cholestasis, cholangitis, increased incidence of the hepatic adenoma, depression, increased risk of the cervical and breast carcinoma, alopecia, erythema multiforme, erythema nodosum may be seen. Contraindications include thrombophlebitis, thromboembolic phenomenon or past history, cardiovascular disorder or past history, unknown vaginal bleeding, suspected breast tumor or estrogen dependent neoplasms, adolescent whose epiphyseal closure is not yet completed. Cautions or the patient that should use OCP with caution includes liver disease patient, asthma, eczema, migraine, diabetes, hypertension, optic neuritis, convulsive disorder, congestive cardiac failure, and fibroid uterus. Now, drug interaction. Rifampicin interacts with OCP leading to therapeutic failure. Alcohol, tobacco, phenytoin, carbamazepine decreases the efficacy. Antibiotics decreases the efficacy of the OCP as because normal flora of the GIT that increase enterohepatic recycling of the estrogen are inhibited. Now, guideline of the prescription of OCP. Age should be about 35 years and obesity and avoid BMI more than 39. History of the smoking, family history of the thrombophlebitis, history of the diabetes mellitus, history of the hypertension, and long-term mobility may be seen. Breastfeeding, pregnancy, cardiac causes, jaundice, past history of carcinoma, undiagnosed vaginal bleeding, history of the taking drugs like rifampicin, history of taking alcohol and tobacco. Now, beneficial effects of OCP. Decreased risk of the ovarian cyst, ovarian carcinoma, and endometrial carcinoma. Lower incidence of the pelvic inflammatory disease, ectopic pregnancy, iron deficiency, osteoporosis, premenstrual symptoms, dysmenorrhea, and endometriosis. Menstruation includes regular, not with excessive bleeding, and no intermenstrual bleeding. Now, progestin only contraceptive. Oral mini pill and parenteral medroxyprogesterone, levonorgestrel. Mini pill. It is oral and should be taken every day. There is no effect on coagulation, may decrease breast carcinoma and increase incidence of the ectopic pregnancy. Medroxyprogesterone, long-acting, water-soluble. There is more failure rate and causes irregular bleeding, permanent sterility, and suppression of the lactation. Levonorgestrel implants are not plant. These are implanted subcutaneously inside the upper arm. Consists of the 6 flexible elastic capsules containing levonorgestrel 260 mg. One capsule contains 36 mg. There is slow release phenomenon and duration of the action is up to 5 years. Disadvantages includes near surgical procedure during insertion and removal of the capsules. Adverse effects includes irregular bleeding, most common, delayed follicular arrest, sterility, ectopic pregnancy 1 to 3 per 1000. End of the topic.